I'm Sinead Mitchell. I am a counsellor, and I've been a counsellor for 2 decades. I have been specialising in the area of fertility and pregnancy and birth pretty much for the best part of those decades. The word perinatal covers everything from pregnancy right up to the end of the first 12 months of a baby's life. I believe that's the technical explanation. And mental health covers everything from feeling a little bit down, feeling a little bit anxious, right through to postpartum psychosis or any other significant mental health, very severe mental health issue. Pregnancy, particularly, for example, in the first 3 months, there's right throughout pregnancy, there's obviously big hormone surges, but particularly at the start, it's a very new thing for people's body. And when hormones, like in similar to PMS, when people struggle with periods and stuff like that, our hormones do interesting things. And so when they do, we can feel sometimes agitated, angry, sad, what people describe as emotional. So that would usually be tearful. All of those things, and a lot of those things are very, very normal. And if any of those normal things concern you, you can just have somebody reassure you that that is okay and that you're just feeling a bit tearful today. But there will be times when we will get more concerned about somebody and see what kind of extra support they may need as well. There's a whole range. So maybe start off with if you already have a pre-existing mental health condition, and that again covers anything from being on medication for anxiety or depression, right up to if you have what we class as a severe mental health condition, perhaps bipolar, history of psychosis. Lots of people when they're pregnant will say, they assume they must come off the medication. The first thing you do is speak to your doctor about that. Speak to your midwife, speak to your doctor, and get advice about your medication. Lots of medications for mental health issues, if you go cold turkey, that's a really not a good thing. And so even if you wish to look at a reduction of medication or perhaps weaning off, which is not always recommended, but if that's what you absolutely want to do, it's do it in stages. Speak to your mental health team. For me, it's about what keeps you comfortable in yourself and what are you comfortable with taking or not taking. Also, if you're not comfortable taking medication, there may be other options to that. There might be other ways of taking care of yourself with alternative treatments. But again, it's something to do in a considered process, not like, let's take that off, let's go to see this other practitioner over here who can make me feel calmer. You may be able to use lots of things in conjunction. There's various things people can access, but whether they're physical therapies, whether they're other kinds of I use the word medication, but like herbal medicine, homeopathy, things like that. But it must be very considered, and it will obviously depend on the severity of your mental health issue as well.
And obviously important to do that with the support of a trained practitioner in those things. Absolutely. Not just head to the internet and order stuff.
Absolutely not. Absolutely
important to
absolutely
get that information from people who know what they're
we're doing. Obviously, as a counsellor, I'm a huge fan of talk therapy. So people get an awful lot out of even 4 to 6 sessions of therapy. Things sit under people's skin for a long time that can cause underlying issues, and if you can alleviate some of those underlying issues, it can just lower that whole thing. And talk therapy might be coming to a local group or a good birth class where there is lovely support and talk about normalize. Having a baby is a big deal. Some people kind of cruise through it and are just fine. Others, for many people, again, there's a whole whole range of things. And so sometimes having some of those lower key anxieties normalized, and again, through birth support groups, through antenatal classes. If you have people that you know and trust in your world, usual to see anything in mainstream media that shows birth in a positive light. And so very often people have no concept that birth does not mean I'm laying on my back screaming in pain, because of course that would be terrifying for anybody, most people. Birth can be calm. Birth can be, for some people, exhilarating. For most people, it's intense. Yes, most people will experience something that they relate to as painful, but others feel strong sensations. So birth itself has all kinds of experiences. What we know about our body is that the lower our cortisol level is, the less we feel pain. So when we are relaxed, and that's not, so obviously for birthing a baby, that's important, but right throughout your pregnancy, generally, as a mental health capacity, I discuss things like exercise with people now, and eating well, because if you get the good nutrition in, there's a strong relation between our gut and our mental well-being. I say that knowing that for many pregnant women, or for some at the start, food is just whatever they can get in. They get in, put in whatever you can. But when you have a choice, and when you are able to, if you can get some really good nutritious food inside, stuff that supports your nervous system, so magnesium-rich food. Speak to people qualified about taking magnesium. Go to a health food shop and talk about getting magnesium in. You can soak in a bath with Epsom salts, that is magnesium. Those kinds of things are very good for our well-being. In exercise, again, if you're dying with morning sickness, I was asking you to exercise, but if you're healthy and well, and it's not pouring rain and stormy like last night, then take yourself out for a half-hour walk. Use the stairs, that's fine. Just do what you can, to be healthy. Down to talk about rest as well. Many of the mums that we see struggling with perinatal mental health have very high standards. When you are growing a baby or postnatally taking care of a baby, there is so much demand on your body. It's phenomenal. My favorite expression is, you're growing another human. So you can be absolutely, truly exhausted just because you're pregnant. Very likely to be out working, and you're likely to be working at least a 9-to-5 job, but you are entitled to ask for support. If you're doing evening shifts and you can't stay awake past 8 p.m, then ask to have things changed. It's perfectly okay, and I'm sure there's legalities around what you can ask for in terms of support for pregnancy when you are really struggling. And I have down also perfectionism. So many people are used to keeping life in shipshape, their house in shipshape, their car in shipshape, their well-being, their appearance, everything. And something about allowing just to let go sometimes, when if all you have the energy for is to grow that baby whilst lying on the couch because you were so exhausted, whether it's about lowering the standards, assuming you have a partner, enlisting partner help, if you have family or friends who can help you out, especially if you've got other small people. Support, ask people, can you take kids one day, so swap things with people who might be in the same boat, that somehow you manage to get rest, and even a half hour. So a lot of times when toddlers nap, that's parents' time where they usually catch up with jobs. Don't catch up with jobs, go lay on the couch, Yeah, and I know they say, sleep while baby's sleeping. Well, sometimes you have to, for sanity, sanity.
And if the washing up isn't done, the washing up is not done. No. And if someone comes to the door and goes, "Oh, I've just come to visit your baby," you can go, yeah, you can hold the baby when you finish the washing up.
Yeah.
We're not used to accepting help often, are we?
Yeah.
We're quite good, I guess, we tend to be better at going, oh, is there anything I can do? But to actually say, yes, there is to that is really difficult, I think, sometimes. Yeah. But actually, it's so important to just teach yourself to do that.
Yep.
And yeah, if you can teach yourself to do that while you're pregnant, you're in practice for it when you really need it.
Yeah.
When you've just had a baby.
You know, being around people who if you have people in your world who have children, they're the people to, and they work for you, they're the people to really tap into, because they do get it. They really get it. But often friends will, you know, I will often say to clients, so if you asked a really good friend to cook you a dinner once a week, what would they say? And most people go, oh, they'd say, yeah. Well, could we do that? And people go, oh, yeah, because they have been asking, can they do anything? So they may not be able to feed your baby if you're breastfeeding. They may not be able to do nights when baby's unsettled, but they could bring you dinner, or they you could hand them a bag of washing and go, if that came back washed and dried, that would make my day. And this is assuming that, you know, you have a swimmingly easy birth, by the way. This is just normal, standard, you know, very little intervention, no surgery, all of that. This is normal stuff that people will need postnatally. Having a sense of what is normal can lower those expectations of self. So if you expect that if you expect your baby's going to be sleeping endless hours, sometimes they will, but sometimes they really, really, really won't. If you find your car keys in the fridge, or, you know, the milk jug in the oven, it's probably quite normal. You know, and it's about sort of adding a little humor into life sometimes to, you know, obviously if these things become a big problem, but it's about, you know, just lowering life standards, you know, like if you find life very serious, then sometimes just adding a little humor in, you know, and just general well-being things of, like, you know, if you're feeling like you're dragging yourself around, put on some music that's good for you, have a little dance, dance with baby. You know, most babies love movement. And always recommend people to consider a sling consultation, or hiring a sling so you can carry baby around, especially an unsettled baby. Lots of these things, if you have an unsettled baby and you can still, I don't know, wash dishes, hang out a load of washing, whatever it is, the thing or walk to the shops to grab bread and milk, whatever the thing is you need to do that day, or for your sanity, or you actually need to make a sandwich to eat or something. You know, a baby strapped to you is often more settled, where if you put them down and they become unsettled again, that's distressing for everybody. So I actually think I think slings should be like part of the mental health, you know, curriculum of how to keep everybody well, because they really, for many people, can make a massive difference, for sure. Okay, so midwife and GP are good ports of call to start with. You know, if generally sort of mid-pregnancy, you're probably looking at every month you see your midwife. Don't wait a month. Absolutely not. This is when you ring up and say, I'm not okay. You know, your GP might be a good person for you to tap into as well. The midwife might do a recommendation. So if you are based in Portsmouth, we do have a mental health team called the DAISY team. At least 2 midwives there who are specialising in mental health. And they will do an assessment as to where your mental health issues will lie, whether that's you just need that extra support, and whether that's anxiety about birth, whether it's anxiety about because a previous birth didn't go okay, all the way to they're really concerned about your well-being, and there is another level of mental health support that they can tap you into then as well. There is medication, as we've talked already. If you've never been on medication, you can go on medication if other things that you're trying are not working. In all of that, you can do talk therapy, and I have somebody who knows you at this point, and then as your pregnancy progresses, or after you have your baby and there's something going on here, they will have a measure of who you are, and have that ability to notice changes in mom. And some of them will be very, very, very obvious. So, you know, around day 3, sometimes postpartum blues can kick in, and very often that's when mom's milk will come in, and so there's like you know, engorged breasts and this new stuff,
just
and
liquid
babies
from all orifices at that point.
It's just everything's happening. Mum might be bleeding.
Tears,
there's milk,
bleeding.
there's tears, there's boobs leaking,
Yeah.
there's bleeding postnatally. Again, lots of people don't know that, you know, don't read up a lot of little bleeding. That can be a big thing. Anecdotally, I hear that the more mum rests, the less she bleeds. You know, so there's this thing of this laying in period that lots of tribes will do, like for 40 days. And I'm not saying you have to get into bed for 40 days after your baby, but I'm saying 40 hours. I'm saying, you know, more than 4 days, definitely, if you can, if that's your sofa or your bed.
Avoid the idea of you have to bounce back. You do not have to bounce back.
No. And bouncing back is resting. You know, you might be absolutely fabulous. You might be feeling really well, and you're still entitled to just be cared for, because that is what helps you heal quickly postpartum. This is incredibly important if you've had a section. Incredibly important. It's important anyway, but it's doubly important because it's major abdominal surgery. So there's extra things to heal. But if you have somebody who, and I know that may not seem like it comes under mental health, but if you are feeling like you have to get up and drag your tired, probably sore body around to do some housework, to change baby when you can hand the baby to somebody else and say, please change my baby for me. These are things that go to support your mental well-being, and to allow yourself permission to ask for that help. And that if you're not changing and bathing your baby, that doesn't make you a bad mom.
Yeah,
absolutely not. Your baby is being cared for beautifully.
Yeah.
And they are things that can, you know, having that support system in place is to support you physically, but very much mentally as well.
For sure.
Very much mentally as well. And so, you know, when we talk about things like anxiety and depression, they can present in so many different ways. So listen to your physiological symptoms. So obviously anxiety, people can have things like heart palpitations, sweats, panic attacks are an obvious one. You know, if you notice yourself being overly fastidious, like, so maybe you're kind of normally relaxed about your house, but all of a sudden your house is completely pristine and perfect and amazing. That might sound amazing, but actually that's one of the signs of things not going so well. That could absolutely include, and if that's postpartum, we really want to talk. We really need to get you support. The more perfect things are after your birth, and when I say perfect, I don't mean normal. I mean calm is fine, but if everything's perfect in your world, and if you're cooking apple pie for the people to come around to see your baby, and your bathroom's pristine and sparkling, we might want to check in. There might be an occasion when that is doable, but that is something where we need to kind of ring some bells and go, let's make sure everything's okay here, that you're not operating on an adrenaline fueled level. If you've ever had psychosis in your life, at any point in your life, you are at a risk beyond 70% of having a recurrence of psychosis postpartum. Postpartum psychosis is a medical emergency. If you have a history of psychosis, you absolutely need to be tapped in to a mental health team, and that needs to be disclosed. And we know a lot more about this now, and all the red flags are in the right place. This doesn't mean tragedy at all. It means that if you aren't in that 30 to 20% who don't get it, so if you don't get it, they just keep a close eye on you, and that's great. If you are in that high category of probability where it recurs, there are people in place. There are mother and baby units where very often mom and baby will go to stay until mom is recovered. So your partner, mom, best friend, those people need to know what postpartum psychosis is and what are the signs. And proper discussion with mental health teams need to happen prior to baby. There was a wonderful lady who is on YouTube, and I'll try and find the link for you. Her name is Claire. She's from up north, and she talked about how the day before she planned to take serious action in her life. Everything was beautiful and perfect, and she had the baby's christening and everything was smiling, and nobody had any idea she was planning to check out. And she was on 5-minute watch, and they caught her at 1 minute because somebody just had the instinct to go in. So there's no way of saying, there's no way of putting this lightly, that if there's a history of psychosis, it absolutely needs to be monitored and managed really well. But done really well. Like all mental health issues, you can come out the other side and be okay.
Yeah.
And be bonded with your baby and such things.
Yeah.
Bonding with babies, there are some great ways to enhance that probability. We know that skin to skin, in something we call the golden hour, where postnatally, baby doesn't need to be weighed immediately. Baby just needs to be, cleaned enough to breathe, and just straight onto mom's bare chest. If mom needs some medical care afterwards, you can have whichever birth partner, assuming it's in very common terms, it might be the dad, get dad to open shirt, baby on, so dads can do skin to skin as well. This is also very good for baby's microbiome, as an aside. Those keeping baby very, very close to you, which is not always encouraged in different settings. And this is not just, so the golden hour is literally the first hour postnatally, or as soon as you can grab that hour if you need to go and be cared for in theatre, or if you're coming to after a general anaesthetic, any of those things. So as soon as you can get baby onto you in a way that's safe, that's we can have that golden hour. But you can have many hours, but the golden hour is a very particular one. But if you're home and you're feeling, like there's lots of emotions going on, just being close by with the baby, really supportive, and having all of that other support so you get to rest. Remember, lots of women have lost more than a night's sleep. Labor can be a slow train, and so until you get into the station, you may have lost more than one night's sleep. And so most people, after losing 2 nights sleep alone, would be quite exhausted. So if you couple that with actually birthing a baby as well, no matter what format that comes in, your body is so exhausted that sometimes all you can do is think of sleep. And you're kind of in survival mode. So not beating yourself up if there's not feeling like an immediate rush with your baby. Obviously, if that goes on for an extended period, these things some people take to motherhood like a duck to water, as they say, and for other people it's just not as natural a process. They just don't have that kind of super maternal urge, but that doesn't make anybody a better or worse mom. It just is. But if it feels like there's detachment from your baby, if it doesn't feel okay to you, then raise a flag and say, I think I need to talk about, I need to get some support with this, and I need to help. You can raise the flags. So usually you will have your midwives in touch with you in approximately 2 weeks postnatally, till the cord comes off, and then you'll have your 6-week check. Not many people get checked out for mental health at that point. But if you need somebody to come with you to speak on your behalf, that's okay. You can speak with a counsellor. You can, if you haven't been tapped into the mental health team, you can get in touch with them. So again, so you could have been dandy right throughout pregnancy, and then baby arrives, and then you feel like you've just fallen like down several floors. Like, again, the what is normal in terms of all of these things, and what people experience is very wide ranging, and all of it warrants attention, but the more abnormal it feels, the more urgently it warrants attention. So some of the things that may contribute to postpartum depression, particularly postpartum being after birth, will be a birth not going as you wish. That involves some sort of trauma. Being sick in pregnancy at the start particularly is quite normal, but there is something called hyperemesis gravidarum, HG for short, which is a astronomical level of sickness where women are sick, sometimes like they talk, they're sick. They're just so deeply unwell, often hospitalized, very, very severely ill. The mental health fallout of that, so people don't associate, well, I'm just being sick, why should I feel so depressed or anxious? But there's a can be a big fallout from, they don't get to feel any level of normality, even pregnancy normality, and that will often only dissipate when baby's born. But then sometimes they've been so ill in that process, they've not even had time to process what they've lost. So often when a baby comes and then the body is responding normally to food intake and such things like that, not only they become a parent, they often will process the loss of those joyous pregnancy are. If you have struggled with hyperemesis, then just again watch out for that. Flag it with people in your world, who may be expecting you to be like, oh, see, you feel great now, bet you feel amazing. Lots of dads I've seen dads go through is lady gets pregnant, dad who's worked all his life, who's always been responsible, goes, oh, I'm now responsible for this family, and there's this kind of like, it all falls to me now. Kind of, I'm absolutely the provider. It's almost like when we do these things, there's something very primal kicks in. Not for everybody, but sometimes you'll get this thing of there's a big shroud of seriousness comes over.
Maybe related to your own experience of being parented and what your parents
valued. That was my next thing. Yep, absolutely. And whether that was like, my dad was an amazing person, how can I ever live up to his standards? Or I didn't know my dad, or my dad was around and then he left, I'm going to be determined not to leave this person. Myriad of things. And again, a lot of that is a normal process for people who are preparing to bring a child into the world as a family. But again, if it becomes like it's not okay, or it starts to slide down, if dads can reach out for help and support as well. And same postnatally as well. There's no guarantee. Everybody goes through all of these emotions, and it can hit people who least expect it to hit them. It can hit people who are a bit more vulnerable as well. So there's no rules. But again, I'll go back to the rest and perfectionism. That can be for dad too. If you can divide and conquer in terms of sleep, if there's a spare room in your house, most babies will be in the room with parents for quite a considerable period of time. So if you don't faff about the nursery and set up a spare bed there, so one of you, like if you're not feeding the baby and mom can get some sleep, or if dad can chip in there or just go and get like a solid however many hours, that one of you is kind of functioning on a relatively normal capacity. Relatives all relative. Again, not having those ridiculously high expectations, and just asking for help and asking for support. And if you as the dad need to go and ask other people to step in where maybe you were normally a great meal maker and you're like, you just can't put one foot in front of the other, you're like, can you bring food tonight? Can you bring food for the next 10 days? I just can't function. And most people say yes, of course. There's loads of groups on Facebook and Instagram, but I think Facebook tends to be more of a chit chat sort of source. And so if you're breastfeeding in the night and you just need somebody to say, am I alone? No, you're not, of course you're not. And somebody else might chime in, and something about that lack of being the only one going through it, whether that's moms or dads or whatever's happening. And asking for, if you need support with something, like, so for example, if you know your baby's not feeding well, don't wait a week to see how it goes. put your hand up straight away and go, I think I need to see a lactation consultant. Few weeks, but if things aren't going well, don't struggle, you know, because that mental health, you know, often the fallout from that mentally
impact. Yeah,
I can't feed my baby, I'm not satisfying my baby, all those things. And it's like, well, no, what's happening here is probably you're not getting the right support, most likely, you know, in probably something, you're more versed in this, Sarah, something in the region of like 98% of cases the issue can be resolved. There's a very few extreme issues where like where we've tried everything and this is still a problem. So, but all, you know, it's about getting support, not being afraid to put your hand up and saying, I need support with this. So to have all that, you know, what is normal, you know, because normal is one of those lovely perfectionist kind of words where like, well, what is normal? Everything's normal. An unsettled baby's normal, a settled baby's normal. You know, a mom who's feeling super worried about just, am I doing it right? That's normal. A calm mom who's just going, yep, seems fine. I'm really happy with that. You don't have to worry. If you're not worrying and everything's fine, that's fine. But if you are struggling, and or maybe not even struggling, but just asking all those questions of, is this normal? I thought my baby would wake up every 40 minutes, but actually my baby's sleeping for 2 hours. Is that okay? And to have that comfort to ask somebody for that normal, you know, to normalize and reassurance, again, it keeps things at an even keel. But if you have a bad day, remember tomorrow is a different day, and you don't have to worry that. So one thing that clients often worry about is having another bad day. So you don't have to worry about that bad day. If another bad day comes, life is like that. So one of my favorite things to say to clients is, we're not flatlining. If we flatline, we're dead. So our life is like this. Life is ripples. So there are normal ups and downs. The up might being, oh look, baby stopped eating, stopped crying, so we could eat for 10 minutes without being interrupted. And the down might be, baby took 3 hours to settle tonight, or baby didn't settle tonight. We just tag teamed the whole night and we're just spent. But when those loops start go, so I put up because that's the manic, that's the everything's too perfect here, and I'm running around and I'm doing everything. And if you're doing that postpartum, we want to talk. That's really important. But also, and the big dip as well. So they're equal on waiting. But there was a normal ripple of life as there is in everyday life. But that is more pronounced and more noticeable when you have a baby.
Yeah.
Or when you're pregnant. Yeah.
Yeah, that's really helpful. Yeah. But thank you so much for all of that. That's brilliant.